problem or blessing that I ran into in my practice was by that time, I was known as seeing people only at late aggressive stage cancer. Nobody came to me for, very few people came to me for earlier stages. It's very, very available now. And there are many practitioners who work either right alongside with standard treatment or standard treatment's done, but there's so many things you can do to get your body back in shape and all of that.
Let's ditch the quick fix and dive into today's conversation. Welcome, everybody. My guest today is Dr. Paul Anderson. And Dr. Anderson, he is recognized as an educator and clinician in integrative and naturopathic medicine with a focus on complex infectious, chronic, and oncological illness. In addition to 3 decades of clinical experience, he also was head of the interventional arm of a U.S. NIH-funded human research trial using IV and integrative therapies in cancer patients. Dr. Anderson founded Advanced Medical Therapies in Seattle, Washington, a clinic focusing on cancer and chronic diseases, and now focuses his time in collaboration with clinics and hospitals in the U.S. and other countries. Welcome, Dr. Anderson. It's a pleasure to have you here today and an honor to have you with us today.
Thanks for having me.
I might add, you're a teacher that is sharing tons and tons of great information with your own podcast and with other sources. And I've been the beneficiary of that information, and I plan to continue to be. So I'm very thankful to have you on today. And I know you've got a lot of good things to share in our conversation.
Thank you.
Awesome. So I thought, let's spend just kind of an oversight, if you will, on your areas of expertise. Maybe start with the cancer, chronic illness, and then we'll maybe try to get into a little bit of the current status of what you're seeing with COVID. But if we could just, kind of start with the outline of cancer and what got you into that and your history in general of getting into this field of interest.
The shortest version of all those stories is originally many years ago, I started very much as a general practitioner. I was in a couple of small towns in Oregon practicing, and I saw everybody from, babies to elderly, which was great. One of the things that I started to develop really early in my practice, which was, believe it or not very common back then, was the use of intravenous nutrient therapies and some other injection therapies, that are very common now. But again, they just weren't much back then. They were very frowned upon by the standard medical community, et cetera. So I was doing a lot of mostly integrative family practice, but I started to get people who were chronically ill and they needed some higher level, intervention. And then without any plan at all, what happened was people with cancer started to find out our clinic did some of these IV nutrient therapies, et cetera. And because it was so hard to find, they all found me. So suddenly I was sort of pushed into the world of integrative cancer work, which there wasn't a lot of back then. And what I started to notice was, not only we could help people, which was great, but my chronic illness side of my practice had many of the same concepts required as my cancer patients, because at least in the, integrative or naturopathic oncology community, your job is different from, say, a medical or a radiation oncologist, where they have very, very focused protocols and very finite endpoints. What we're working with, I would always tell people, is the entire rest of their body. Really, while there may be something where you're trying to irritate the cancer or get rid of an infection or, some endpoint like that, most of what you're trying to do is keep the body working to its maximum potential. So that was a long time ago, and it took off from there, really. So started working into more and more specific therapies with cancer patients and also chronically ill folks. And really, how sometimes you're at the right or wrong place at the right or wrong time.
Right.
I was kind of part of a group of people who were developing a lot of these things independently, and we all started to talk. And a lot of what we see now in that, world, at least the interventional side, came from a lot of what we were doing all those years ago. So, and most of my colleagues from those days decided to 100% focus on either the cancer side of things or say the chronic illness side of things. What I found was I always had about 50-50 in my practice, and it was largely because the tools and the concepts of holistically treating a human aren't really different on one side or the other of the ledger. And then that's what led later to that research you were talking about. Is just I happen to be a person with experience in that area, and we actually learned some things there too. So that's the short story of how I got there.
So, and when you're talking about, integrative therapies, I'm anticipating that some of that was high dose vitamin C injections and other things like that, Myers cocktail.
Yeah.
I think that you have authored or co-authored a book on thinking outside the box or outside the box strategies for cancer. Is that to incorporate some of that information?
Yeah. So, way back, it was what people were looking for. They'd heard about high dose vitamin C, and there were very few places doing that. So that's we started doing that. And then general nutrient therapies, like you mentioned, a Myers cocktail, which is a sort of, I always tell people it's like a multivitamin being infused into you. And we really expanded that repertoire from there. But yes, that's kind of where it all started. If people are watching on video behind me, there's two books. Outside the Box Cancer Therapies, Dr. Mark Stengler and myself, we were in medical school together. We wrote it, and we split the chapters up into the areas of our personal expertise.
Okay.
And we have about 1,100 references in the book, not really for the reader as much as what do we all hear when you take some information to your oncologist? Well, there's no research on that. So in our, herbal medicine section, there's over 300 references. In the IV section, there's 200 and some, diet, lots, as we all know, there is research. So that book's very specifically about interventions, but also how do you prioritize? Because there's, now that the internet's there's a million ideas,
right?
And you could spend all of your money and not know which thing you're doing. So we just tried to write it as, okay, we've been doing this for 50 plus years together, and how would we guide you to allocate your resources if we had to? And then the second book is called Cancer: The Diagnosis from Journey to Empowerment. So it's as I say, agnostic of how you treat your cancer, but it's more how do you take care of your mind and your mind-body connection while you get this really hard diagnosis.
Very important.
So those two, they're quite popular out in the world, I hear, and we're hoping to help people. Yeah.
Yeah, that's great. Do you find in your history that you were being, like you said, people were looking for this information, they were coming to you for this type of treatment? Were you kind of all over the spectrum of, stages of cancer and intensities of cancers and types of cancer, addressing all of the above kind of thing?
Initially, back when it was, it's not great now, but back in those days, 25, 30 years ago, it was very antagonistic, where oncologists would tell people, I won't treat you if you go see, this person, which is always a great position to be in,
Yeah.
So initially, almost all of our patients were sort of at the end of the line, and the oncologist said, well, do whatever you want to do, or they were pretty advanced. So those of us from that generation, I feel like we sort of cut our teeth on the worst of the worst, which is, it's sad and hard to do, but it's also a way to learn what are your limits there, like
Sure.
How much of the human do you have left to work with, and what's appropriate,
Sure.
Then over time, the specialty of integrative oncology, and then naturopathic oncology as a specialty, started to develop. And we got a lot more people wanting prevention or early treatment, or early stage grade work. The problem or blessing that I ran into in my practice was, by that time, I was known as seeing people only at late aggressive stage cancer. nobody came to me for, very few people came to me for earlier stages.
Earlier stage.
It's very, very available now. And there are many practitioners who work either right alongside with standard treatment, or standard treatment's done, but there's so many things you can do to get your body back in shape and all of that. So there's a lot of that goes on now. But really my specialty area and what I teach about now to other doctors is, what do you do when you're at, say, a high stage, high grade cancer, and yet the person still has vitality, their immune system's still trying, how do we focus and maximize on that? So thankfully I've got a lot of really good colleagues who do all the rest.
Oh, that's great. Yeah, I know it's a huge positive impact and a source of hope for all stages, but to have some opportunity in late stage, especially if you can get some integrative kind of approach. Quality of life is huge, and just achieving some improvement in quality of life is a huge positive for the patients. And I'm sure you saw that with what you were doing.
Yeah. In fact, especially with late stage, almost everybody, that's their number one goal is, quality of life. All of us are going to leave the world at some point. We don't know how long we have. Cancer patients just have a little bit, maybe better idea of that.
Right.
And so what they're really after is, what do I do to make myself the healthiest and the most effective for whatever time I have left? And what normally will happen, in fact, I can't think of an example where it didn't happen, is as you are improving quality of life and treating kind of the whole person, usually their length of life extends too, because they are more themselves, and it doesn't mean it makes the cancer go away, but it means that they're able to do what they need to do and be in less pain, and they can, proceed in their life much more normally.
More normal, a little bit more comfortable. Essentially, connecting a little bit of the chronic illness flavor of this conversation, which I would like to know your thoughts and your experience on, the commonalities of how you treat somebody with chronic illness, some of the way that the body becomes desensitized to its illnesses and or has subclinical reality. But ultimately, a lot of this is dealing with the immune system, including cancer. So I wanted to maybe just kind of step into that a little bit, and how the body's, got dead cellular parts, dead this and that, and it gets used to its status, and how to address that.
The person who's chronically ill, essentially underneath everything, has many of the same needs and focus areas as, say, a cancer patient who maybe is going to recover and needs to get their body back. What makes us tick and what makes us run isn't terribly different on either side of the ledger. Now, sometimes your priorities are different, with a cancer patient versus a chronically ill person. And mentally and emotionally, one of the difficult parts about chronic illness that any patient would share with you is, a cancer patient usually can say, well, I have a very survivable or a very unsurvivable cancer. A chronically ill patient just has this nebulous, I've not been well for however long, nobody knows what to do with me. It's a very self-defeating thing unless you got a good team working with you. I started to, especially during that cancer research, I started to get reflective about, well, just with cancer or chronically ill people, let's look back over these decades. What's the characteristics of treatment or investigation or whatever that identified people who were going to do better? Where did we look for trouble and where did we find it? And my staff, my doctors that were working with me, I shared it with them, and they called it the Anderson 8, but it's just 8 areas, as a holistic look. As you mentioned just earlier, is a great setup. The first one is cell function, because, we're more than cells, but if our cells don't work, we don't work very well. And cell function nowadays, includes things that we know about nutrigenomics and, things that affect, from our diet or supplementation to our cells working better or worse because of who we are genetically. It includes, mitochondrial function, which nowadays everybody's talking about finally. And
right.
And then there's a lot of other cell organelles, that if they're not working, the cells don't work. And then there's just the people often forget that the cell has its own little environment,
Right.
and it takes in oxygen, sends out carbon dioxide, tries to send toxins out. So if the area that the cell lives in is not able to do that, the cells get sicker and sicker. So cell function is a big first one that, it's a big picture thing, and it includes your nutrition, of course, everything.
Huge. And we got quite a few of those human cells going on in the body.
Yes, a few trillions of those, and then the next thing that I noticed that was something that if you didn't at least look at it would get you, in the end with a chronically ill or cancer patient, that's toxins. And we now, I think in the modern world, we have like 50, 80,000 chemicals we didn't have 100 years ago.
Wow. I didn't know that number.
It's a lot. And, it's just the natural evolution of
Sure.
industrial age. Well, what we don't think about, because, we eat and drink all day long and all this stuff. And most people don't realize just how much toxicity, the air, the water they drink, the food they eat, just passively brings in your body every day.
Right. Not to mention all the EMFs and dirty electricity. And
I mean, we're in a soup that we, some of it we can change, some we can't change. We can't avoid whatever the, radiation that's going on, et cetera. So, and people think, well, your body's set up with natural detox mechanisms, which is true. But those mechanisms, came about for the way the world was, 200 years ago, where you didn't have as many toxins to deal with. So I find in a lot of chronically ill patients, and also in cancer survivors who want to clean their whole system up, we always screen them for, a body burden of toxins, which is always an estimate, but it's very common to find people either with, sequestered chemicals or mycotoxins from mold or even metals, et cetera. So if you don't clean that junk up, and you can never remove all of it, but if you don't sort of clean that up, the toxins basically take that cell, milieu, that little cell interaction that should be good, and just slow it down, make it worse. So toxins. Then there's a few of the parts of the 8 things that are really revolve around our relationship with microbes. And so again, kind of like we have natural detox stuff in our body.
Sure.
We have an immune system that's pretty amazing. And what happens though is if you're a robustly healthy person, that's usually keeping you on balance. You're not carrying around a lot of, bugs that are bothering you. Chronically ill people or cancer patients who've had a lot of, say, chemotherapy or other things that slow the immune system down, but especially chronically ill people, start to collect opportunistic infections. So, their brother or sister could look just like them and not have any problem with these infections.
Right.
Their immune systems run down. So the infection just takes advantage of you. And then you start to add on. So your immune infectious kind of interaction becomes a very big thing to at least like toxins, at least look. If it's not a big deal, great, move on, but that's a big area.
Sure.
One of you had mentioned, which is something I would always try and talk to patients about, your body essentially compensates for chronic illness. So, they don't realize, well, you have normal physiology, but when you've been sick for 10 years, your body turns it all down. So this is normal now. It's lower, it runs slower, it doesn't clean up as well. And so, it's normal, but it's because you've compensated to being an ill person.
And a lot of times people will throw it into, hey, they don't even realize that they're missing it. Like for me in my world, just they're not able to turn their neck more than 20 degrees when it should be 80 degrees. And they don't even know it's lost. And so they have the lack of the loss. And then they also have I'm just getting older kind of mentality. And it's like, your cells aren't very old. The bone cells are the oldest cells. And they're only 7 to 10 years old, at most.
Yeah.
And so I try to share that thought a little bit.
I think it's just human nature that, as your function goes down, you find ways to justify it. And it's very easy. A lot of doctors will just tell people, well, you're getting older, and that's, not really true. But one of the ways that the body does this down regulation, especially in chronic illness, is through our hormonal system, our endocrine system, because it's set to be very responsive. And just like if your immune system's at top shape, you don't tend to get a lot of, bad infections, et cetera. Your endocrine system's really humming along, everything's balanced, your reproductive hormones, and your brain hormones, and your adrenals, and, everybody's kind of talking to each other. As you get chronically ill, your body says, we can't run the cells at full speed anymore. They don't have the reserves for it. So the endocrine system is used to just sort of turn, I always tell people it's like being in a lower gear. You're shifted down and you can't get out of first gear, which is why you feel the way you do. So, that system, I've never seen a chronically ill person where that system didn't need some care and feeding and love and all of that. And then psychosocial is huge, especially the longer you're sick. Our mind-body connection gets beat up pretty bad when we don't feel well. The whole, digestive system is, of course, the way we get nutrients, but it's also its own nervous system, its own immune system. Those don't work very well when your body's not working. And then the last, these don't go in any order, so it's not like the last area I think of, but physical and structural things, like you were saying, if our body has become metabolically slow, but also we can't move our body,
biomechanically slow,
we're not very functional, or we're in pain all the time, so we don't want to do anything. So those are really, and they of course expand into bigger areas, but those 8 areas become so important the more chronically ill or the more beat up the body is, say after cancer, that you at least take a look at all of them to get a sense of, well, holistically, how much is it a small, medium, or large project we're going to have to work on here? And the reason I put that together was mostly, I knew there was something that we were doing repeatedly, but you don't do any reflection, you never know. Well, this was just a way to keep me on track so that 3 months into a complex case, I could say, maybe we haven't looked at that toxic load as much as we should, or maybe your hormones aren't as great as they look or something. So yeah, that's kind of my approach.
A good outline. And I like that idea to be able to refer back. Well, we've addressed 7 of the 8, or we've addressed 4 of the 8. We're a little bit better. We maybe need to go here or there. And that's what's so good about integrative approach. For me in my office personally, I can only address a couple of, those steps. I have to reach out or refer out, to address a couple of the others. The approach that you take then, if you're teaching, doctors, and what you did in your office, multifaceted, of course, nutrition. Sometimes it was, some of the other therapies. What was the base that you tried to, did you try, or maybe I should put it this way, was there a base that you tried to really start with, or totally individualized for everybody, or how did you approach it?
Yeah, my students always wanted me to make it much more simple and streamlined, which I've worked on. But people are so individual. Right. What I would try and get across to them is, okay, you got these 8 targets, and everyone can fool you, but generally speaking, the first set of questions that help to narrow you down really are, how long have you not felt well? And most people don't think that far back often, but you get that kind of story out. What was happening that triggered this, which can be very big. So, for example, if somebody says, 5 years ago, I just started getting colds and flus all the time, and by this year, I've not felt well the whole year. Well, you might have a lot more, say, of the immune, world to look at there. Mm-hmm. Whereas I had people who would say, one lady had been very sick for 30 years, nothing worked. And it really started with a lot of digestive system dysfunction. And then that sort of was the weak link, and it worked its way out. And so that's sort of where we had to look in the beginning. But I try to impart to people that, generally speaking, if someone's been sick for 5 years or less, they're less quote unquote broken or deregulated. 5 to 10, it's going to be a bigger project, and over 10, their body hasn't known normal for so long.
A long period.
Going to be a lot of baby steps, and usually that means then the more rocks we have to turn over. So generally, there's always something to do with the kind of the basics with folks. Working on their diet and digestion is sort of, that's going to be a lifelong project. So we kind of get that going early. The physical and structural things, because that's so much of our functionality, and but also just chronic pain and the way we feel and things like that. Even just getting people to move their body, go from 0 minutes a day, to walking around their house once, or going up the stairs once, or whatever, get the big muscles moving. So there's a lot of those things. And then it's, and you get patients who, some want to be very aggressive and look at everything all at once. And some want to say, well, let's do the basics, and in 3 months, let's see what's still, holding me back. That works great, So a lot of the core functional things: are they sleeping? Are they moving? Are they eating at least semi-appropriately? And does their gut actually work, anymore? All those things. So we at least can start there. And then sometimes there's real obvious things, such as, they really should have their thyroid and adrenal function checked out, or their reproductive hormones are very obviously way, deregulated. And so we go down that road fairly early. But a lot of it is, think of the basics of what makes humans work. At least start there, and then whatever's left over becomes fairly obvious.
Yeah, and that, when you're working at that level, and with chronic illness, especially, the whole idea about this podcast is it's not a quick fix; it's a journey. And trying to help people get just on that journey mentality and be comfortable with it. And again, I even at the whatever stage, no cancer, first, second, third, fourth stage, or whatever, I just kind of try to push that quality of life mentality and quality in as much as you can. Nobody's going to be perfect. You're not going to be able to eat perfectly, drink perfectly, and all those kind of things. Then there's those that are really darn close. I give them credit.
Oh yeah.
If you can get to 60, 70% of the time doing things pretty well, you're going to make a big impact, no matter, establish that foundation. Hey, thanks so much for listening to Ditch the Quick Fix. If you received value from this episode, we'd love it if you could share it with someone that's also on or seeking the path to better health. And if you're ready to take the next step, head on over to ditchthequickfix.com. There's lots of resources there. And I'll see you next time when we finish up our conversation with Dr. Paul Anderson. Have a great day.